Hi guys, happy hump day. It's Chrissy Thomas with About Face Skincare, and we are coming to you with our third in the series of webinars. We've been doing these on Zoom. This is actually, I guess, yeah, the third week that we've been doing this, and we had wanted to get some information together to share with you and couldn't find an appropriate platform, couldn't slow down long enough to get it done. So now COVID has slowed things down for us and we have time to get some of those projects off of our list. So just going through and thinking about things that you guys would appreciate understanding in order to understand why we want you to do certain things and suggest certain treatments, maybe find out about products and treatments that you didn't know about before. So again, I'm Chrissy Thomas. I've owned About Face Skincare for about 18 years. I know there's supposed to be some people with us tonight that have never met us before. So a little background, I'm a former plastic surgery nurse and opened About Face Skincare 18 years ago now. And we now have a staff of about 15 people. My husband, Sam, joined me 10 years ago to work on our marketing and some of the business things that we do. So it is now a true team effort, always has been, but now a true team effort. So we hope we get to meet you soon if we don't know you. So what I thought we would talk about tonight is eyes, lips, and necks. Those are three things that seem to come up in almost every single conversation, along with weight. That comes up in almost every single conversation with clients that I work with on a daily basis. So I want to talk a little bit about those things. Before we get started, I want to mention that we are extending what was our spring sale. Our special 15% off spring sale is now just a, hey, we want to give you a present through this quarantine. So we are offering 15% off on all of our products and services right now. If you want to purchase Botox or Juvederm or any of our services, just send me a message through Facebook or through our website, aboutfaceskin.com, and let me know and we can set it up for you to purchase that. I do have some coupons from Allergan for injectable filler. I mentioned that on an email I sent out to our clients today. So if you're interested in having some Juvederm, Voluma, Volbella, just send me a message and let me know. Not only do we offer the 15% off, but we are giving you the $75 off as well, and we can pull up any brilliant distinction points you have. So we can take care of all of that. And we're doing virtual consultations. We've been doing a lot of those. They're really fun. We've really enjoyed that. So if you're new to us or if you're an existing client and you just need some help with your plan of action, what we need to do when we get back and how we need to structure your appointments, just let me know. Again, through an email, text, Facebook Messenger, whatever you want to do, just let me know and we'll get either a virtual consultation or we can just send you an email and tell you how we would like for you to plan. Some of our non-surgical facelifters are concerned because they need to catch up on those appointments. Their Botox is behind, things like that. So we'll be happy to help you. It's a whole lot easier while we're home and we're quiet than it is to catch us for 5 minutes when we're back in the office. So Mary and I are really encouraging those discussions right now. Okay, so let's get started. So first, I want to talk about eyes. So if you think about the structure of the eye, and if you think about the skeletons that you've seen before in the classroom or the lab or whatever, you know that the eye is actually just a hole in the skull. And when I think about that, that explains a little bit about the reason that the eyes age so drastically over time is that they don't have that bony support and they don't have a lot of fat and muscle behind them to keep them supported. So as we age, just like if you were to put a piece of fabric over a hole, if you pull it tight, it's going to look fine. But if you loosen your grip, and the skin loosens its grip over time, then you're going to start to notice that that isn't quite as tight. And that makes perfect sense if you think about it. We lose muscle support under the eye. So you'll notice if you look at a person that's a little bit more mature, you'll notice that where the eye is tight and closed on a younger person, you start to see a little bit of a sag in that muscle and that fat pad can tilt outward a little bit. So not only do you notice a little bit of puffiness, you notice a little bit more opening in the eye sometimes, and you notice that you've got a little bit more darkening or hollowness under the eye. That's because that little fat pad does start to break down as we age. We also notice this muscle is just a big sheet of muscle. We treat that with Botox. But you notice as you age, sometimes that muscle starts to sag down a little bit and make the eyes look heavier. The brows that used to have a little bit of lift sometimes can look very straight. So there's things that we need to do to lift that up. And sometimes it's the other problem. You have maybe a family history of people getting the real hooded eyes over time. The eyelids get a little bit longer. That can be from sun damage or just a genetic trait. And that's another thing that can make you look a little bit older around the eyes. Repetitive motion. We smile, we get smile lines. We frown, we get frown lines. We raise our eyebrows, we get forehead lines. That repetitive motion does make a crease in the skin. And whenever you're talking about eyes that really don't have a lot of oil glands around them, those lines can get etched in a little bit more, and sun exposure can make that worse. So it's a whole plethora of things that can come together to make the eyes age a little bit more quickly. So I want to talk about some things that you can do at home while we're in quarantine or just on the side that can help you take care of your eyes and turn back the clock a little bit. First of all, I want you to remove your eye makeup. I know, you guys, I see it. Some of you have confessed it, and some of you were just doing the dance because we know that you're not taking your makeup off at night. So if you are wearing mascara and wearing eyeshadow and maybe some brow powder and you're going to bed in it, at night, your pores open up in your skin and drink in anything that's on the surface. So if you're going to bed with pollution on your face and dirt from being outside, pollen, makeup, all these things, you're really putting your skin at a disadvantage. And whenever you consider the way the eyes are with the lack of oil glands and the thinner tissue and thinner muscular support, you really are putting your eyes to a disadvantage if you're not cleansing properly before you go to bed. So I've tried to find something in the professional arena to remove eye makeup for years. I wear waterproof mascara. Some say I really shouldn't. I like it. My lashes are very straight and I curl them too. That's two big no-nos I hear. So what I like to do is take my eye makeup off with a Covergirl product. I'll try to put it close so you guys can see it. It's Covergirl Clean. And I've used this since I was about 14 years old, but it's a lotion instead of an oil, so it doesn't leave that film on my eyes when I wash my face. I just take it, I actually use my finger so I know how much pressure I'm putting on my lid and my lashes, and I know that I'm not putting too much friction with a cloth or any other device. So I just put a little bit on my middle finger, I just close and I massage my lashes until they feel clean. I get my eyelid and I get my brow. Get all that brow powder off. And then I just rinse it with some water. And then I cleanse my face for the 2 full rounds of happy birthday that we talked about last week. So I want to make sure that I'm really getting everything clean before I go to bed. And the eyes are a big deal. This is great for getting off lip pigment too. If you wear those lip stains or you have some lipstick on, it's great for getting that off as well. Now, next, I want you to apply a really good eye cream 2 times a day. Now, I do want you to use an eye cream. Moisturizers are good. You can use a moisturizer around your eyes if you really don't have anything else. But eye creams are designed to be used on those tissues that have less oil glands, that need a little bit more nourishment, a little bit more antioxidant, a little bit gentler exfoliation property. So I've picked 3 of my favorites that I want to talk to you about tonight. The one that I've been using for quite a while that I just am so in love with is the Dej Eye Cream. So we talked about Dej Face Cream and Dej Night Cream last week. So the Dej Eye cream is the same family. It's loaded with peptides. So it's going to be really good to rejuvenize the skin. For someone who's a little bit sensitive to retinol, you know, we talked about how we want to use peptides to stimulate collagen if we can't use retinols to stimulate collagen, or if we want to boost it up just a little bit. I love the Dej Eye Cream. I can use it on my lids and under my eyes, and I am going to pause to show you a picture because I happened to accidentally catch a picture of myself about 6 months apart when I was using this eye cream. I think I can pull it up here. There's probably a fancy way to do split screen, but we're just going to do this for tonight. So you see how before, everything is backwards. Before, I was a little puffier under the eye, and just look at the after. Oh, how much smoother and tighter my under eye is. So I was sold. I could even tell that my lids got a little bit tighter, which is a problem for me and my family. We get heavier lids. So I would say if your problem is lax skin and a little bit of puffiness, some lines, things like that, if you need some skin rejuvenation, the Dej Eye Cream would be your pick. Now, another favorite in our practice is the Eraser Eye Cream. So the Eraser Eye Cream is part of our 180 line. And the eraser is awesome. It has a little bit of trans-retinol in it. So it's safe to exfoliate the tissue around your eyes, which is really hard to find. Eyelids need exfoliation, under eyes need exfoliation, but it's hard to do that without creating a lot of inflammation. So this is an awesome eye cream to use. It has a cute little twisty top. You would just use a little bit, go right up to the lash line with that. With this one, I would be a little bit more careful with the lids. I feel like you can use it on your lids, but you never want to go great guns with a new product just whoosh, all the way around the eye, because you can be a little more sensitive in that tissue. So I would do a test patch, just a little bit on the eyelid for a couple nights, make sure you're okay. And then you could use it, especially on the brow bone, and maybe just a little bit on that upper eyelid for some tightening and smoothing. And I would say use this product if you have a lot of little lines under here and crow's feet lines that you want to work on. This product is great for exfoliating lines, gives you a boost of antioxidants. Now, there is a new product that I love. It just came out from SkinMedica. So I've actually switched to this, and people will ask me about that. I will sometimes get married to a product like the Dej Eye. It worked so well, I didn't change off of that for about a year. And then I thought, well, maybe I want to change around. Maybe I want to use a bottle of this, and then a bottle of this one, and a bottle of this one, just to get the benefits of all of them, and so my skin doesn't get used to whatever product I'm using. So I have switched over to the new Instant Bright from SkinMedica. Instant Bright is awesome. So if you watched our webinar from last Wednesday, you remember that we were talking about how we need to get peptides to stimulate collagen. So they have peptides in this cream. They have the Lateral technology that we were talking about that can help reduce pigment. So I would say if you're having an issue with under eye darkness, the Lateral property in this cream is wonderful for going underneath the eye and lightening that pigment, or the eyelids. I know some of our darker skin types have issues with darkening around the eyes as they age, and that is wonderful for helping that. It also has the HA5 technology in it. So you remember HA5 is the serum from SkinMedica that is loaded with hyaluronic acid, 5 different types of hyaluronic acid. Hyaluronic acid is that water magnet in our products that absorb water from the deeper tissues and maybe from the humidity, if there's humidity in the air, and it makes the skin look smoother because it's giving it a boost of hydration. And the other ingredient I wanted to mention in this Instant Bright is caffeine. It has some caffeine in it, which is going to tighten the tissue under the eye. So I've been using that under my eye and on my lid, and I am so happy with that. That has been a great product. They also came out with these, which are so fun because we don't get a lot of fun stuff. If any of the medical distributors are watching, we don't get the cute rolly bars and things like that. So we were really excited. Instant Bright eye mask. It's also a SkinMedica product. So the Instant Bright mask come in a little package like this. You get 6 of them in the box. They look like this. So you just peel it off, you put it underneath your eye. It's going to give you a boost of the ingredients in the eye cream, a boost of hydration. You can use them once a week. You can use them every day. It's up to you. And you don't rinse it off after you use it. You just follow with your eye cream. So those are my favorite things to use as far as our eye creams go. Our eye gel is probably one of our top selling products. People love this around their eyes, and I do too. But if you remember the conversation we had the other night about using your products, your treatment serums, and using a cream as a barrier that keeps it on the skin, that is the case with the eye gel. The eye gel's awesome. It's primarily just hyaluronic acid. But I don't want that to evaporate off of your skin. So I would prefer you use this on your skin and use maybe one of the creams on top to give you a little bit more nourishment and more moisture and a little bit of an occlusive barrier so it holds that on overnight. Now, if you wanted to kick it up a notch, I would say, and I've been talking about this little guy, this device has come in so handy. We have sold so many of these since we've been closed because there's very little you can do at home above and beyond putting on creams and putting on masks. These have been phenomenal for quarantine. I was smart thinking ahead, didn't know it. So the ASAP device by the Aqua Gold people. I brought mine in here just to show you guys tonight. So if you wanted to kick up your hydration treatment around your eyes, I would recommend that you use your eye gel or even the Revision Revox, because we talked last week about how this is like a topical Botox. This is going to help relax fine lines and creases and tighten skin a little bit. So whenever you use the ASAP, it comes in it's a little vial that you take the top off of. The needles are very fine. Now we do a treatment in the office that uses 0.6 millimeter needles. That is sold to be done without numbing, but to me that hurts. So we always put numbing cream on you for that unless you tell us you don't want it. The home device is only a 0.2 millimeter needle. And there's about 20 of those. They're little gold needles and you can't see them. They are so tiny, and this doesn't hurt me, the biggest weenie in the field. So if I can tolerate it, I know you can. You would just take your eye gel and squirt a couple of drops in there. You can always add more, and I don't want to waste product, so I always start with 2 or 3 drops. You could use the Revox and squirt a couple of drops. You could squirt them both together and put it around your eyes. I don't want you to use creams. Creams will mess this device up. It's meant for something very thin like a serum. So you just squirt whatever serums you want to use in there when you're working around the eyes. Make sure it's something that your eyes are not going to disagree with. The eye gel should be fine. The Revox should be fine. The vitamin C product should be fine. But just as I said, I want you to test patch because I don't want you to get yourself in a situation where you've gotten a little bit more than you're bargaining for around the eye. So I would stick with something we know is going to be good and safe around the eye. I always put the cap back on. I turn it upside down, put it on the counter. I wash my face, brush my teeth, pick out my pajama pants I'm going to wear all day tomorrow. And then I come back and I clean my face thoroughly. And I take my device, leaving it upside down because, of course, we want that serum to seep down into those needles. And I just hold my head back so that I am perpendicular with the device. And you just straight in, straight up, straight down, straight up. So it's straight. We're not rolling with this. We're straight down, stamping the skin. Overlap about 30%. It's not, rocket science. If you don't overlap 30%, it's not going to hurt anything. You can go all the way up to the lash line here. You can get the bony part of your brow. Sometimes I actually raise my lid so I have more skin on the bony part, and I will just treat that crease just to try to tighten, lift my eyelids a little bit. After you're finished, I want you to take the device apart, wash everything with warm soapy water, separate the 3 pieces, and lay it out to dry, and it's ready to go again. The device is sold to be used on face, neck, chest, and hands about 6 to 12 times. Basically, you can use this till the needles are dull. I have used it for my same device for quite a while, so it's not like it has to be replaced very often. I will tell you, this has been a device that has changed our practice, and especially with the quarantine, people are purchasing this and they're very happy with the results they're seeing. So I would highly recommend you get one of these and work on those trouble spots at home. As a side note, we're talking about eyes, but as a side note, you could put some of your vitamin C serums in it to work on dark spots. You can put some acne medication in it to work on acneic breakouts. All kinds of things you can do with this. So this is a very useful device to use at home, especially right now. Now, when we get back into the office, there's more things that we can do to make your eyes look better. If you are not a Botox user, Botox is a great idea just to turn the clock back on your eye area. We use a little Botox here on the 11s. I think most everybody knows that now. There's been enough TV publicity and media out there on that. So there are muscles on the insides of your eyebrows that are attached beneath a muscle that runs right here. It's important to know Botox makes the muscle do the opposite of what it wants to do. for 120 days. So it's not a long-term fix, which is good and bad. If you love it, that's okay, kind of bad. If you're not happy with it, we can adjust it a little bit over time. So Botox is something that has been very popular in our practice. And I would say I've been surprised at the number of people that have started using it. It's been a great addition years and years ago, and we are one of the top 500 in the country now that use Botox. We put just a little bit here and here on the internal side of the eyebrow and just a little bit in the middle. As I said, it does the opposite of what the muscle wants to do. So instead of frowning down and making those 11s, it lifts and separates just a little bit. It feels like the weight of the world has been lifted off your shoulders, but it lifts and separates just a little bit, giving you just a little bit more lid opening. We can put just a little bit here in the lateral brow because as we age, that lateral brow pushes down. As I push, you recognize this on faces as they age. That pushes down. So if we put a little Botox on that lateral brow muscle, it lifts slightly and that opens that eye back up like it used to be. If you have those smile lines, those tight smile lines, we can put just a little bit on the crow's feet. And when you smile, you still smile, you can still crinkle, but you just don't get the grooves and you won't get the permanent etched grooves whenever you smile. So Botox is really nice for softening your look. Sometimes people are afraid they're going to get that crazy Hollywood look, and that actually is kind of hard to do. I've only had a couple of people that said, my eyebrows raised too much, please don't do that again. That's probably happened twice in 18 years. You really get just a little bit of lifting, a little bit of opening. It's not anything crazy. It's not anything that somebody would say, what have you done? It's just a real soft, natural look. Another thing we started doing, and I'm afraid we didn't have time to promote this very much before we close, so I want to tell you about it here. The Gua Sha Facial. And Gua Sha, Gua SHA facial is something that some of you may have even heard of because people are using these little stones at home to do their own facial, but we have incorporated it with our Derm Young products, and it has turned out to be a very popular, very nice facial for depuffing and moving some of that creating some lymphatic drainage in the face. The face has a hard time with that. So those of you that do our non-surgical facelift, we use microcurrent to lift and firm and tighten muscles. It sort of does the same thing. It'll open up that lymphatic channel and drain the face so the face looks less puffy. Whenever we're doing our Gua Sha, we use the Bion stone. You'll see rose quartz and you'll see jade stones and all sorts of stones being used. We like the Bion stone because the Bion stone creates the most ultrasonic pulses when it creates friction on the skin. So if you come in to see one of our estheticians and you're going to have a Gua Sha facial, they're going to do some really nice massaging type moves with the stone. And it's all over the face, all over the neck. But for the purposes of tonight's discussion, I will tell you they use it around the eye area to open the lymphatic channels around the eyes. So under here, and also on the brow, it's going to help lift the brow a little bit. Whenever you put the stone against the skin and create friction, the ultrasonic pulses are what creates that lymphatic emptying and that little bit of muscle tightening. I love this. I am somebody that just tends to be puffy. My lips are puffy. My face is puffy. I can eat a tortilla chip and I'm going to be puffy. These facials really help me feel like my face isn't quite as puffy. So I highly recommend you get in and get one of these done. We use the smaller sizes of the Derm Young products whenever we do this facial. When we're done, we're going to send the rest of that Derm Young product home with you. So you really need to try to get in. Not only is it relaxing, your skin glows and you are less puffy, less stressed looking, and we are all going to need that. And another thing I want to mention is the halo treatment. So the halo treatment, if you look that up, it's going to be a laser. I thought it was a cute name because it makes you look like you're just an angel. It makes your skin look very smooth, and didn't consider that if you Googled it, you're going to find something totally different. But whenever we're doing our halo treatment, we're using the device like I'm telling you that you should use at home, but we're using the office device. So rather than being the 0.2 millimeter needles, it's the 0.6 millimeter needles. And we draw a little blood from you. I know we've talked a little bit about PRP before. So platelet-rich plasma, when we draw a little blood from your arm and we put it into our centrifuge and we spin it for 8 minutes, it is spinning out those red blood cells. And what is left is the golden platelet-rich plasma. Now, platelet-rich plasma is going to help the body do what it wanted to do 10 years ago. It's going to remind the body to do what it did when you were younger. We use it to grow hair. We use it to rejuvenize the face. We use it to rejuvenize hands, which by way of putting it in the hands makes the nails grow stronger and firmer. So whenever we're using it for the halo, I take a little bit of that PRP and I inject it under the eyes, and that creates a nice collagen effect. So we not only do that, we also take the little device, we put 15 units of Botox, we put Juvederm, and we put your PRP in here. And with those 0.6 millimeter needles, we're able to microneedle into the skin and get into that intradermal layer where we're going to tighten pores, decrease redness, and help with fine lines and creases. But if you think about doing the Botox and the Juvederm and the PRP around here, not only are we stimulating collagen, the Botox is going to help tighten pores, but it's going to help those little creases relax around the eyes. And that Juvederm is a really nice, intense hyaluronic acid that's going to draw water from the tissue and make those under eyes look softer and smoother, more supple. So that is actually my favorite treatment. It's hard to take time whenever you work at About Face to get things done, as we can all attest to that work there. So that is something that I seriously try every 4 to 6 months to grab Mary and have her give me a halo treatment, because I feel like it really helps a lot with my under eye hollowness. I have large pores, I have acne scars, I have melasma, which is brown stains on my skin, and I have pustular rosacea. And I take care of a lot of that with that simple halo treatment. There's other things through the year that I get done, but that is something that I truly try to keep for the rosacea, the melasma, and the pore tightening and acne scars. Now, lastly, with eyes, I want to talk about microblading, because we tend to lose our lashes and our brows over time. That's just something that happens over time. And I remember a few years back, I started thinking, oh my gosh, what am I doing wrong with my eyeshadow? What am I doing wrong with my Botox? And I kept playing with my eyes. I couldn't figure it out. And I was losing my eyebrows. So whenever Sona taught me to color in my eyebrows, it's like, oh, okay, that's what I was missing. So one thing that you can do while you're at home is use Latisse on your lashes and your eyebrows. We talked a little bit about this a couple of weeks ago. Latisse is the golden standard for growing eyelashes. Latisse has an ingredient in it that actually helps stimulate hair growth. So you can use it on your lashes, and you can use it on your eyebrows to help the brows grow. Some people even use it right through here where they start thinning, and it helps that hair grow. Another product that we have that you can use on your lashes is called Luscious Lash. It's in our 180 line, and I don't have it to show because since the last webinar, it has sold out, and we're waiting on the next shipment to arrive this week. So Luscious Lash is more a vitamin concoction that you put on the lashes. And I always say that the Latisse makes my lashes grow longer, and Luscious Lash makes them grow thicker. Now, I find with my eyebrows, the Latisse works better. I put a little bit of Latisse on at night before I go to bed, and it really does make my eyebrows grow back in like they used to be. So I do support using Latisse on your eyebrows. I put a drop on my brush and do each eye, and then I put a drop for each eyebrow and use it for that. But I'm not sure that everybody's aware. We have actually been microblading at About Face for, I think, about a year now. And it's one of those things that we've launched, but we really haven't had, we seem like we moved so fast. This has been an interesting time that we've been able to slow down and say, okay, these are the things that we need to make sure everybody knows about. Alini and Sherry, our estheticians that many of you know, are excellent microbladers. They've been trained in sterile technique with doing microblading, and they do a fabulous job. So those appointments are a little bit more lengthy. We first bring you in for consultation, make sure you don't have any issues that would make it not be a good idea for you. And then we bring you back and we map them on so you can see what it's going to look like. We talk about your design, the way you like for your brows to look. If you have any asymmetries, I've always had an eyebrow that sits lower than the other, so that's something that I have to consider. Just draw them on and let you look at them and see what they look like. And then if all that goes well, we put the numbing cream on and we will start the microblading process. So microblading is not like tattooing, and that tattooing we're permanently placing. We don't do it, but you are permanently placing pigment under the skin. Where microblading is the little device looks like a little pronged device that you're almost dipping in the pigment and you're scratching it beneath the surface of the skin. So it's what they call semi-permanent. It's going to last 1 to 3 years. So whenever you put it on, it looks real natural. It almost looks like little hair strokes. So it looks like your eyebrows, but you wake up with them on. It's wonderful. Just like when you have tattooing, you don't want to use exfoliation or anything that turns over the cells. You don't want to put on pigmented areas, whether it's your eyebrows or lips or whatever, because it will take some of that pigment away. But we have had some very happy customers, and I have some pictures that I can share if you would like to talk about doing microblading. And it's a good time while we're closed to go ahead and get that consultation out of the way. If you'd like to have a virtual consultation, we could go ahead and go through the questionnaire, make sure there's not any medications or any issues with you that you would not be a good candidate. So you'd be ready to get that done when we open. Okay, so we're going to move on now. We're going to talk about lips. I am a lip freak. I went to the beach whenever I was 14, didn't put anything on my lips, and I woke up the next morning. I have big lips anyway. Woke up the next morning, started to do this, and I couldn't fit my lip in my mouth. It was so incredibly swollen. So ever since then, I feel like my lips are sensitive. They swell with anything. When I was pregnant, that's how I knew. Both times lips got swollen. So I am very careful about what I do for my lips. It's important to know that your lips have no oil glands. So your lips are depending on your nutrition, your hydration, and the things that you put on them to stay moist and supple and not wrinkled and not creasing. Lips are naturally going to lose a little bit of their volume over time. And that's why you'll notice if you look at pictures of yourself 10 years ago, if you're 40s, 50s, 60s, and you look at pictures of yourself from 10 years ago, you can see how your lips decrease over time. And I have people that come in and say, I used to have lips, but they've just disappeared. Well, they haven't disappeared. They're just sitting inside your mouth, and we need to restore them. So we're going to get back to that in a minute. But I first want to talk to you about the things that I want you to do at home for your lips. I want you to cleanse them. Just like the eyes, it's important to cleanse your lips, because if you don't cleanse them and you just slap some chapstick on and you go to bed, you've got the dirt and the pollution and maybe the lipstick from the day, and it's occluded against your lip, and the pores are going to open, and that's all the nutrition they're going to get. So you need to make sure that you thoroughly cleanse your lips before you go to bed. I like for you to exfoliate your lips, and there's some little sugar scrubs. We have some Farmhouse Fresh stuff in the office. It's not on our site, but we do have some little sugar scrubs and things that you can actually rub your lips and get some of the dead skin cells off. I use my toothbrush. When I brush my teeth, I just gently take my toothbrush and rub my lips to make sure that I've got all the dead skin cells off of there. Let's see. I want to get my products here to show you. There's a few things we sell, and I use them all because I am a lip freak. So one of the things that is very popular that I have put so many people on is the SkinCeuticals Antioxidant Lip Repair. This little product, when it came out, is a cream, and I've tried everything. I am so desperate. I once used some vegetable oil on my lips when Sam and I went to a cabin and I had nothing else. I always had to have something on my lips. And I think people have called it being a chapstick addict, where you just can't go without your chapstick. Well, it makes sense. If you listened to the webinar last week and I said you have to have something nourishing under an occlusive, because if you just put an occlusive on, something that's dry, and you don't have anything that's making moisture or repairing underneath it, it's just sitting on dry skin. So as it wears off, you're going to feel like you've got to put more on. When I started using the SkinCeuticals product, it was the first time that I didn't go searching for chapstick all day long. It's an antioxidant repair. It has a little bit of an exfoliation property to it as well. I put this on morning and evening. I've had a lot of people that have had damage from fever blisters or maybe electrolysis or something where they have felt like their lips have been sort of damaged over time. This has changed my world. I love this product. I sell it to everybody that I can. It is called the SkinCeuticals Antioxidant Lip Repair. Now, there is also a product with SkinMedica that I love, and this one is really neat. It is their HA5 So it's an HA5 and they call it a smooth and plump lip system. So it actually comes with 2 tubes. You have the HA5, which is like a cream. So it is like their HA5 technology. It's a cream that you're going to put on the lip and it's going to sink right in. And hyaluronic acid is going to draw water to the surface from the deeper tissues and make those lips more supple. Then they have a lip plumper that is like the glossy lip plumpers that you can put on, and it's going to give you a little bit of that puff and pout. So this HA5 lip system is very popular and people love this. They love making the lips healthier with the HA5, which is a phenomenal hyaluronic acid product, and then topping it with that plumper to get that nice fuller little pout. Another product that I like for you guys to use is, and we just brought this in recently, but it has been wildly popular. We've gone through like 10 cases of this at a week. It's called Lip Smart, and it's also full of hyaluronic acids and peptides. So they have something called the 60-second challenge. And quickly, I'm going to look at my pictures. As I said, I know there's a better way to do this, but I had taken a picture of one of my clients. Oh, let me see if I can find it real quick. And maybe I can't. And that's okay. I'll put it on the website or put it on the Facebook later. But you can put it on, you can actually see the hydration. It gets really intensely hydrated, softens all those little creases. It lasts for about 4 hours. So I keep one in my desk at work. I think we all do. I think the whole staff keeps theirs in their desk at work. And we put it on a couple of times a day. You can put it underneath lipstick or on top of lipstick. And it's wonderful for keeping the tissue hydrated. It does not plump, but it just keeps the tissue really nicely hydrated. 2 more things I want to tell you about for lips. One is our 180 Plump. This is awesome if you like a plumper because it also contains sunscreen. So it is going to, has hyaluronic acid, which is going to draw fluid to those tissues and make them look nicer, plus a plumper, which is going to make them get a little bit more pink and a little bit more full. But it also has the sunscreen protection that you need. If you're going out and you're just wearing a lip gloss on your lips and you're not wearing a sunscreen, it's dangerous. It's like putting cooking oil on and going out with the most delicate tissue exposed. And that's one reason I think that we see so many smokers lines. Everybody complains of smokers lines. I've never smoked, I have smokers lines. One reason is we lose lip volume, which I'm going to come back to. And the other reason is because we don't protect our lips enough whenever we're out in the sun. We put sunscreen on. We don't always get our eyes. We rarely get our lips, and we sometimes forget our neck. So that's one of the main reasons we're talking about these things is they don't get adequate sun coverage, sun protection. So this plump, if you want a lip plumper, I highly recommend this one because you do get the sunscreen protection. It's lovely, very popular seller. And the Elta, I like this to go in the tennis bags of every person that plays tennis in the area because this is a 31 SPF lip balm. It is a great protection. It's that transparent zinc oxide, so it stays on and it protects your lips adequately if you're outside for any period of time. So if you're going to the beach, if you're gardening, playing tennis, running, any of those things where you're going to be outside for any amount of time, I highly recommend you keep this in your bag. Okay, now when we're able to go back to the office, I want to talk about lip filler. And I think 50% of you just went, I will never get my lips done. And I can understand that because, I mean, I'm terrified of lip filler. I was born with big lips. I was actually bullied whenever I was in school for having big lips. I was a little chubby and people called me Fat Albert because I had big lips and I was a little chubby. So I'm a little sensitive to that. But you can restore your lips and not look like you've had your lips done. So many times clients will come in and they say, I don't want you to touch my lips, but I want you to fix these little lines that I have all the way around the outside of my lips. That's going to be hard to do if you don't restore your lip tissue. And the reason is, as you age, you lose your lip volume. And so if you think about an older woman, and I mean an older woman, maybe even the stereotypical older woman that looks like this. That's because those lips are empty of their natural tissue and it's all turned inside their mouth. So there is no mouth anymore. And by restoring that lip with injectable filler, you don't look freaky. You just look like you always did. And I have a picture of a friend of mine that I'm going to show you that I did lip restoration on. She may be watching. I'm not going to call her out. That would be mean. But I just thought that this was such a beautiful job because you see where she had some lip creases and she had smaller lips. And you see how in this picture, she just has her lips back like she wants them. She has a little bit of gloss on there. But that's what we're talking about. We certainly have the people that come in and want lip enhancement, and we are happy to do that for you. A lot of people come and they want their lips to be just a little fuller than they used to be. We get a few people that want them much fuller than they used to be, and we are here to serve and please, so we're going to do whatever you want us to do. But I love to take somebody who says, oh my gosh, my lips just, I don't have balance to my face anymore. This is very small. You know, maybe my whole face looks great, but my mouth is turning inside. And it does wonders for balancing your face if you just restore the lips back to what they used to be. So as I mentioned earlier, Allergan gave us some $75 coupons. So if you are interested in restoring the lips, it's the perfect time. We have a 15% discount and I can give you the $75 coupon. So just shoot me a message either through Facebook or through our website or my personal email, any of those ways, and just let me know that you want one of those coupons because we didn't get a ton of those and I'm trying to save them for, first come, first serve. So just let me know. But I can promise you won't be disappointed or look too big if that's not what you're looking for. And it's also nice to say you can reverse Juvederm. We have a product in-house that you could actually inject in there and all of that is gone if you didn't like it. So not that we've ever had to do that, but it sure does give you peace of mind if you're a little nervous about that. We can break it down. Another treatment I wanted to tell you about is Aqua Gold. Just like the Halo, we can use the PRP with Botox and Juvederm, and it is very nice to take that and, we do the whole face and neck when we do it, but since we're talking about lips, we go right across the mouth area and we're able to use the Botox to soften the creases. The Juvederm is going to plump that area and make those creases less noticeable. We can do it with PRP or without. Either way, without PRP, we call the treatment Aqua Gold. With PRP, we call it a Halo treatment. Now, if you wanted to get a little bit more creative at home and make your lips look a little bit fuller, once again, I'm going to pull out this little ASAP device because using this at home with our eye gel, so you just, again, you open the top, you put 3 or 4 squirts of the eye gel in, you put the top on, turn it upside down. Wash your face, brush your teeth. By the time you come back, it's ready to go. The needles are only 0.2 millimeters, so you're not going to damage your tissue. It's not going to hurt, but you can go right over your lips with that hydration and plant that hyaluronic acid just beneath the surface of the skin, and it's going to make the lips look nice and full. It's going to help with some of the little lines and dehydration appearance that you get around the mouth. And you can do that every day. There's no limit. I do mine about once a week, but you can use the little device every day if you wanted to be a little bit more aggressive with that. Okay, and now we're going to move on to our last topic. We're going to talk about necks. So when you think about the neck, necks get a lot of sun exposure. And as I said earlier, sometimes we forget to really coat it. But if you go out and you have on a cotton t-shirt, your chest is going to have a 2 SPF on it. The neck is very rarely ever covered. So the whole neck and chest area takes a beating when you're outside. So it's real important for all of your skincare products to not only do your face, but to do your neck as well. Sometimes your neck is a little bit sensitive, so you have to be careful with your retinol products, but you can certainly use your peptide and growth factor products, like we talked about last week in last week's webinar, to help the skin on the neck look a little bit better. When you think about the neck muscles aren't attached as tightly to the skin as some of the facial muscles are. So without that attachment and with the gravity, we notice that skin pull down a little bit earlier. I remember my first experience. I was on a plane getting ready to take off. I looked down at my iPad. It was dark and thought, oh my God, what has happened? So that is one of the first things that we hear from people. There's very few oil glands in the neck, so that tissue does look dry and dehydrated very easily. So you do have to make sure that you give it ample treatment. A preventative measure, there's a couple things you can do to help your neck age well. When you spray perfumes, it's important to remember most colognes and perfumes have a degree of alcohol in them, which is very drying. So if you're spraying every day, even a spritz on the neck, as you go out the door and you're not adequately moisturizing, you're putting alcohol right on your neck, which is a very vulnerable spot, and you're taken off for the day. So try to spray your perfumes a little bit lower down or on your wrists so that you're not putting that alcohol directly on your neck. And also tech neck, which I can only imagine after quarantine, we're all sitting like this and our necks are creasing. So if you could get in the habit of using your device at eye level so that you're not looking down and creating those creases, it is going to help a little bit over time. Now, one of the things that I absolutely love, and I am very faithful to this product, is the Revisions Nectifirm Advanced. Now, they have the original Nectifirm, and we have so many people that love that product. It comes in a little jar and use that product faithfully. I didn't see a lot when I used that, and maybe I was younger and didn't need it as much at that time, but even now, I don't see as much with that product. When they came out with the Nectifirm Advanced, it has twice as much of the active ingredient in it. And I can really tell a difference whenever I use it faithfully and I start thinking I look cute and I don't have to use it anymore and I stop. I can tell that, boy, I really have to use Nectifirm. So I do use my Nectifirm Advanced twice a day. There are ingredients in this that will actually tighten that tissue and break down the fat pockets in the neck that develop over time. So that is a great product to get. Again, I'm going to tell you the little ASAP device with some extra hydration, or with, you guys know, I'm a big fan of the Youth Essence, the vitamin C product by Derm Young. I use that a lot on my neck. And I do use this little device to treat my neck once a week, just because that is such a vulnerable spot for me. Now, as far as necks go, one reason we see the neck aging is because we are losing volume in other spots. So I always like to mention this because sometimes people are surprised, but whenever you come to see us and you say, my neck looks horrible, sometimes it's because, and this light's kind of weird, but when I do that, when I pull my cheek back, you can see that it makes my neck and jawline look a little better. As we age, we lose the fat and the muscle tone and some of the bone in our jawline and our malar ridge here. And it allows that skin to sag down and it makes the neck look even saggier. So that's something that we do a whole lot of at About Face, is restore the jawline and restore the back of the cheek. We don't do so much here because you know, like me, I have very full cheeks. I'm very full right there. So you would never want to make me look filler, or I would not be able to see when I smile. That's the first place I gain weight. But back here, when I do that, it actually makes my face look thinner. So that's how we use the Voluma, is to anchor back the malar ridge, lift the face, lift and restructure the jawline, and it helps the neck. So if you're interested, that's something that we can talk about, is rejuvenating the mid face and the lower face and helping everything in the process. Another thing we do is we take a mixture of PRP with a little bit of Juvederm, a little bit of filler, and we inject it directly into the neck tissue just to rejuvenate that. That PRP builds collagen and it makes that neck look a little tighter. It helps with discoloration. It does a lot of things that make that neck look tighter. So that's something very popular. And I also wanted to mention sunscreen for the neck as well as the full body. This is a popular product that sometimes I find people don't know about, and I'm real surprised. It is the Elta product. It's a lotion. So it's an SPF 30, but it's also a body lotion. This is awesome to coat your neck and your décolleté, your hands, your arm. I mean, it's great to use all over. A lot of my tennis players and golfers use this every day. And then they use our sport version whenever they're right outside in that hot sun. But this product is very popular, and it's a great price point for this big, I think it's a 7-ounce bottle. So that's something to check out on our website. I think you guys would like that. So I think that we have gotten through the all the information on eyes, lips, and necks. A couple things I want to mention to you. We sent out some information today, and just in case you didn't get to see it, I want to mention we have started an effort to give a little bit of comfort to our ICU staff in the area. I know from being a nurse, and not that kind of nurse, but from being a nurse, Mary and I have talked about how our hands stay chapped and old all the time. And Tara, our new nurse who still works in the hospital, laments that as well. We wash our hands so much that our hands get chapped. So I can only imagine what our ICU staff is going through right now with taking care of our sickest patients with COVID and other things that are going on in the hospital, and just trying to think of something that we could do to give them a little help. So what we have done is an initiative called Help Us Help Our Heroes. And when you guys get on our website and order our intensive hand repair lotion, which is a velvety, awesome lotion that creates this nice little coating on your hands that gives them back that hydration. They lose that chapped feeling that you get when you wash a lot. We're going to be sending a tube to the ICU staff at Northside Gwinnett and at Eastside Medical Center, our two hospitals in our area. So we've sent out information on that. You'll find it on our Facebook page. If you have any questions, again, just text or email, call, leave a message, and we'll get that information to you. But whenever you purchase a tube, we're going to mail your tube to you, and we're going to set a tube aside that we are going to be delivering to Northside Gwinnett and to Eastside Medical Center. We're going to try to outfit all of the ICU staff with a tube of the lotion just to send some love and let them know that we're all thinking about them. As I mentioned earlier, we are having our 15% off sale still. So if there's anything that you'd like to purchase or consider, it's a good time to go ahead and purchase it. And we're going to be opening soon, and we will get you right in to get those treatments done. We can go ahead and mail your products to you. We are doing virtual consultations, as I mentioned earlier, so just send me a message. I'm happy. There's no charge for that. And sometimes it's good just to get one-on-one with me or with Mary, one of the estheticians, whomever you prefer, and we can just talk through what you're using on your skin if you're not an existing client, or you are and you haven't started using any of our products, or you have some questions about what we do. We're happy to go through that with you and help you make some choices. Even if you wanted to make a plan for the year, if you didn't want to purchase things now, but you just want to kind of purchase as you go along, we have time now to make those plans. That goes for our existing clients. Some of you guys that have bank services that are wondering what you can do, we're happy to make that plan for you. This is a great time to email me, because when we get started again, it's going to be hard to find that 5 minutes to sit down and make our plan. So just let me know that you want me to make a plan for what you do whenever you come back. I can forward the information to Mary or Sherry, Alini, Sona, Latrinda, Olivia, Peggy, all of the estheticians, and let them know that we need a plan for you to get started on to schedule as soon as we get open. And if you want to get on our appointment list, when we closed, we didn't cancel appointments, we just left it. So if you had an appointment, your appointment's still sitting there, and that's our list to go back to know where to start to schedule those appointments. So you'll be getting a call from us, and we're going to try to just lay that grid back on the day that we open and start from there. If you didn't have an appointment and you want us to get you worked in around all of those appointments, just send me, again, information. Send me a text, an email, a Facebook message, and let me know. We have a master list running of people that are wanting to get appointments, and we'll get you worked in. I sent an email out earlier today, but we're just trying to look out for your BD points. We're here if you need us for anything. Just let us know. I made some polls. I've never done Facebook Live. We've been doing Zoom for the past 3 weeks, which is it's been fun. I haven't even paused to see how this is working. So we'll see how this goes. We may go Zooming again next week, but you have links to those if you want to go back and watch them. If you have any issues with that, let me know. And this has been a lot of fun. Thank you guys for joining us and helping us pass a little bit of our time. I hope you guys had a good time, and we will see you soon. Take care.